Is a prostate ultrasound a painful procedure? When considering a prostate ultrasound, many people wonder about the level of discomfort involved. Generally, a prostate ultrasound is regarded as a safe and minimally uncomfortable procedure. This exam typically requires the insertion of a small probe into the rectum to obtain images of the prostate gland. Most patients report only mild discomfort or pressure during this process, which is often comparable to, or even less, than a standard digital rectal exam performed by a healthcare provider. The rectal wall in the area around the prostate is relatively insensitive to pain, which helps to keep discomfort to a minimum. However, if a prostate biopsy is performed during the ultrasound, the experience may become more uncomfortable. This type of biopsy, known as a transrectal ultrasound-guided prostate biopsy, involves multiple needle passes through the rectal wall into the prostate to collect tissue samples. The discomfort during the biopsy can stem from several factors. The insertion and manipulation of the ultrasound probe can cause some mechanical stretching and pressure, which may be uncomfortable for some individuals. Additionally, the needle punctures needed to administer local anesthetic can also lead to some pain. The core biopsy itself, which typically involves around 10 to 12 needle passes into the prostate and rectal wall, is often the most painful aspect of the procedure. Pain levels can vary significantly among patients and depend on individual pain sensitivity, any existing conditions like chronic prostatitis, and the specific technique used during the biopsy. Research indicates that pain scores during a biopsy generally range from mild to moderate, with average scores around 3-4 on a scale of 0 to 10. Approximately 16% of patients report more significant pain, with scores of 5 or higher. Interestingly, the apical part of the prostate, which is the tip, tends to be more sensitive, leading to increased discomfort during a biopsy in that area. Fortunately, there are effective pain control methods that can significantly reduce discomfort during a biopsy. One of the most effective techniques is the paraprostatic nerve block anesthesia, which has been shown to reduce pain more effectively than local gels or sedation alone. Although this nerve block requires additional needle injections, it typically results in lower overall pain during the biopsy itself. Other options, such as sedation and analgesics, may also be utilized to improve comfort. In summary, a prostate ultrasound without a biopsy is usually not painful, causing only mild discomfort similar to that of a rectal exam. If a biopsy is performed, some degree of pain or discomfort is common, primarily due to the needle passes into the prostate. Effective pain management techniques, such as paraprostatic nerve block anesthesia, can help minimize discomfort during the biopsy. Individual experiences can vary, and those with conditions like chronic prostatitis may experience higher levels of pain. It is always advisable for patients to discuss pain management options with their healthcare provider before undergoing the procedure. Overall, both prostate ultrasound and biopsy serve as important diagnostic tools for prostate cancer and prostate health, and the discomfort involved is generally manageable with the right techniques.